Good evening, everyone. If you are not from Texas, welcome to Texas Virtually. I am Russ Durstein. I am the Deputy Director of Concerned Veterans for America. We want to welcome you tonight. We have some important things to discuss, and we have two panelists tonight that I think you're going to find very informative. Let me share with you just a little bit about Representative Chip Roy. He's a former federal prosecutor, and he has had the chance to get to serve and work with some prominent Texas officials. He's worked for both Senator Cruz and Senator John Cornyn. Ted Cruz, he was his chief of staff. He's also served for Assistant Attorney General under Ken Paxton. And currently, Representative Roy serves on the Budget, Oversight, and Veterans Affairs Committees, and he's a ranking member for the Oversight Committee on Civil Rights and Civil Liberties. For those of you that aren't familiar with this district, it stretches from South Austin through the Hill Country. It's all gorgeous there, all the way to downtown San Antonio. And with that, tonight's discussion will be led by our Executive Director for Concerned Veterans for America, Nate Anderson, Green Beret, great guy, and a good friend. So Nate, take it away, and I'll come back for the Q&A at the end of the panel discussion.
Sounds great. Thank you, Russ. Thank you, Representative, for being here. And to everybody on the channel tonight, welcome to tonight's Concerned Veterans for America Policy Forum with Representative Chip Roy. We hope that you and your families are safe tonight, that you're healthy right now. As Russ mentioned, my name is Nate Anderson. I'm the Executive Director for Concerned Vets for America. And I am coming to you tonight from my home in Minnesota. Normally, we would do this from Texas, where Representative Roy is. And to be honest with you, I wish I could be there tonight, but I know most of us are holding down the fort at home. And so we're going to do it online here. I will say, among the states I wished I lived in, Texas is certainly at the top. Don't tell my family, they'd be very sad, but it's the truth, and I'll own that. I love Texas a lot. I'm an Army veteran. I've spent my military career in special operations as a Green Beret. I absolutely love the military. I know probably a lot of people on the line here have served. I love the brotherhood that it forms. I love the sense of mission that you get out of it. And, when I got out of active duty, I lost that for a short time, and I really missed it. And I'm sure some of you might relate to that kind of a feeling. But then I got involved with this group called Concerned Veterans for America. And there was something about the organization that really jumped out at me. Specifically, they gave me a new mission. I felt like I was part of something. And on top of that, they were really good at getting stuff done. They were highly effective. And so that drew me into the organization. And I've been a part of them ever since. And I like to tell people, we're like a next mission for those who hang up their uniform, but they want to continue to serve our great country. Our mission is to advocate for policies that preserve the freedoms, preserve the prosperity here in America that our families have sacrificed for. And, I think that veterans and their families have a very unique relationship with the freedoms and liberties that we enjoy. And that's because we have skin in the game. We've sacrificed, we've served, we love this country. And so that when we elevate our voices together, when we advocate, people listen. People really pay attention to what we have to say. And that's very powerful. So we're building a movement, and we're giving veterans and the military community a chance to have their voice heard. Before we get into tonight's discussion, I just want to acknowledge a little bit about the audience that we have with us tonight. On the line, we not only have constituents from the state of Texas, we also have activists from across the country, so a broader audience, as well as some staff members from CVA, some of our great field staff, as well as headquarters staff in Arlington, Virginia. And so it's a diverse audience. Some of the conversation is going to probably focus toward those of you in Texas, and that's why we're here. That's why Representative Roy is here. But then some of it's also going to be a little bit more broad and apply to a larger audience. So that's kind of how the conversation is going to go. The last thing I want to open up with here is that we're here tonight to talk through some challenges that our country is facing, and particularly how it affects the military and the veteran community. The spread of COVID-19 is a situation that's creating a great deal of hardship in the country, certainly in terms of people's health, people's physical well-being, but much broader than that also, people's livelihoods, their ability to provide for their families, even their ability to be physically with their families in some cases is challenged. And that's causing a lot of challenges for people in all sectors, in business, in government, in education, and certainly in our communities. And so let's get into our discussion. Representative, welcome. Thank you for taking the time to be here with us tonight.
Well, Nate, thank you. Thanks, Russ. Thanks for everybody for joining. Obviously, I wish we could do this in person, or I certainly wish you could be in Texas. With all due respect to your great home state, we would love to have you down here. I'm blessed to live on 10.5 acres, and so we were shooting some guns just Sunday night and having a good time out here on our 10 acres, which under Texas law you're allowed to do. So
maybe next time.
We're trying to figure out how to socially distance the right way.
Indeed.
But really appreciate everybody joining. When we set this up, this was pre-coronavirus when we talked about having this call this month. So we would have been talking more broadly about healthcare and about ways we can be assets to veterans and make sure we're doing the right things for the veteran community, and broadly issues that affect all Americans. And we'll touch on a lot of those issues, no doubt, in some of the questions tonight generally. Obviously, coronavirus is first and foremost on our mind right now and how we navigate through it. And look, as I say to everybody, we've faced a lot of challenges, and just as we cured polio and defeated Nazis and put a man on the moon and rebuilt Southern Manhattan, we're going to get through this. I was just having a Zoom meeting with my staff because we're separated and can't see each other. And we were just having a meeting a couple hours ago in which I was laying out, I view this in sort of three components. One, we've got to beat the virus. But two, and really importantly, we've got to make sure we keep our businesses afloat that are currently struggling and get dollars to them and capital flowing. And then three, we got to get our economy started again. And I know a lot of folks on this call will agree with me on that. And we've got to make sure that we figure out the right balance in all of those things. But a lot of the coverage so far has been very pandemic heavy. And I think we need to be focused a lot on that 6 million number this week. We're up to 10 million unemployed, and we got to get our businesses rolling again. And hopefully we'll do that soon. But happy to talk about all these issues. We've been working really hard to improve the VA. We had a great conversation with the head of the VA, Mr. Wilkie, just not a couple of weeks ago, about what's going on there, some of the challenges they face with respect to coronavirus. VA has been on top of that, but I'm happy to go down any road you all want to, and I'll leave it open to questions, but really appreciate the time.
Wonderful. Thank you so much for taking your time to be here. We really appreciate it. So I just want to start by asking how your constituents are doing. How are you and your staff serving them during a time like this, all the constituent services that you provide?
Well, I appreciate that question. First of all, my office is, open to anybody who needs help. We've been trying to reach out to those in the district affirmatively ourselves, reaching out to business owners, reaching out to restaurant owners, reaching out to veterans communities. I've got a regular veterans advisory group that I talk to every at least once a month. My staff does on a regular basis. We're having a call tomorrow, and we're going to go through some of the issues and make sure that I'm in tune to what's going on. We've been fielding calls with constituents who are stuck abroad, for example, in Peru. But we are doing whatever we can to help constituents navigate through this. Right now, we're focused heavily on helping them navigate the Small Business Administration loan structure that was passed in the bill last week. And we're making sure that we're trying to help those who are seeking care and trying to figure out what to do in this environment where we're dealing with some of the state and local restrictions that are being put on movement and which businesses can operate and which ones can't, and making sure that we can provide those resources. But if anybody's curious, please reach out to my office, go to my website at roy.house.gov, and make sure that you reach out and ask any questions that are on your mind. And we'll be happy to address them. We try to have a 24-hour turnaround unless we get too inundated. My staff, to answer your question, we're doing fine. So far, so good in terms of illnesses. We've had a few of our colleagues, some of my colleagues that have come down with the coronavirus, and some staff members throughout the complex. my staff's doing fine, and they're scattered in their offices around the DC, Northern Virginia area, and then back here in the district. So.
Good. That's really good to hear. Are there community organizations that are stepping up to the plate to care for at-risk demographics that your constituents really ought to know about? Grocery shopping, any kinds of services out there? And really, larger than that, what can people do to take care of their neighbors at a time like this?
Yeah, well, I appreciate that question. One of the things we tried to launch 2 weeks ago early in the process is an effort to make sure our seniors are cared for. They're obviously one of the more vulnerable populations. My dad is 77 years old and a polio survivor, and my mom is 71. But both of them I have obviously concerns with. They're up in Northeast Texas, and make sure they're cared for. The best thing we can do is try to make sure we're paying attention and help the elderly get access to things. If you're germ-free, and are able to help them get food or able to get access to things so they don't have to expose themselves in a public setting, that's certainly a good way to go about it. There are nonprofit organizations that are helping step up. I would probably run through some, except that I don't know which ones have been affected by the governor's executive order yesterday or the day before. But needless to say, there's countless organizations that are working right now to help get people the help and support they need. Reach out to my office and my website if you're looking to figure out how to help. I know there's a lot of folks that are sewing masks and doing things at home to be able to help those navigate through until we get the mask production up. The good news is that our free market system is working when it's being allowed to, and the president is reaching out to a lot of our manufacturers, Tesla, General Motors, Ford, even Brooks Brothers yesterday said they're shutting their lines down and going to manufacture PPE gowns and protective clothing for our healthcare workers. So everybody's getting in the game, and I don't think GM has an automobile on the line right now. Now, that raises its own set of concerns going forward economically. But right now, we're trying to get our hands on and beat the virus. And look, I can talk about this in other questions, but this gets to our supply chain, over dependence on China, making sure we combat that, and happy to talk about those issues as well. But reach out to my office anytime if you want to know how best to help people in the community.
Yeah, I know a lot of people are getting involved to do what they can at a time like this when normal just isn't a thing for a lot of businesses and communities out there. My next question is around veteran healthcare policy. You were definitely a big supporter of the VA Mission Act, and the increase in healthcare choice that it provides for veterans. Recently, the VA has begun this, what they're calling a strategic pause in community care referrals for veterans, possibly up to 90 days or so during this crisis. Are you concerned about how this might end up affecting veterans in your district and across the country, their ability to access healthcare options within their community?
Well, it's a good question. Certainly I was a little distressed by seeing the sort of pushing pause on the Mission Act. I think the Mission Act is one of the great changes and the great initiatives that we're seeing carried out to expand options, expand choice for veterans. I'm a proponent of that. I want to expand it. I don't want to retract it. Of course, right now, when you're in kind of a wartime type setting, as the veterans know better than most, you adjust, you adapt, you modify, and you figure out what to do. The good news is the VA was one of the early healthcare entities to engage in dealing with Corona. The focus on making sure our veterans had early testing and the ability to be able to deal with this has been fairly strong. The president told Mr. Wilkie that he wanted to have a strong focus on veterans in this process and make sure that they're cared for. A significant amount of resources were allocated for the VA in the phase 3 bill last Friday, the $2 trillion bill, a little bigger than I might have chosen if I were the one drafting the bill, as you might expect. But it had, I think, 20-something billion dollars in there allocated for the VA, 14 billion of it directly for healthcare, another tranche for technology and other things. We're trying to encourage telemedicine, telehealth, and those sorts of things. But to answer your question, I think the Mission Act, look, we're under operating orders right now from the governor in the state of Texas to try to minimize most private practice at the moment. Now, we can debate how long that should be the case, but that's what's going on. And so this pause on the Mission Act, I don't see as any kind of real strategic backing away of the importance of that, as much as just figuring out how to manage this current crisis at the moment. I'm confident that we'll get back and get that in place. And the VA is right out there in the front of making sure that veterans have what they need to get through the coronavirus issue.
If veterans do end up with issues with getting that care from the VA facilities or the VA system right now, what can they do through your office to highlight those issues?
Well, first of all, reach out. Let us know that you're having those issues. Second of all, we can help give you the resources needed to reach out to the VA and the phone numbers necessary to call the VA. And now, this is one of the things that's really important. This is true for all healthcare, whether it's private sector or through the VA, is that if you feel like you've got symptoms or that you've been exposed or you might have an issue, call. Make sure you reach out to them, because we want to make sure that we're not either exposing others or unnecessarily exposing yourself. If you've just got a bug and it isn't the coronavirus, they want you to call, check in, and so forth. So call the main number, call Audie Murphy in San Antonio, call Kerrville, call the main line at Veterans Affairs to work through that. There's a lot of telemedicine that's really getting pushed and advanced, which is a good thing. That's where the future of medicine really ought to go in many respects. And I know, for example, the FCC, my good friend Ajit Pai, FCC commissioner, was just on the news this morning. I was watching him talking about the money that was allocated last Friday to help advance telemedicine in order to help those who want to have access to get the kind of input they need from healthcare providers. That's increasing and encouraging as well. So please reach out to my office directly. Go to the website and reach out to us and call, and we'll be happy to help direct you and point you at what to do. And look, the VA is really focused in trying to stay on top of this, and we'll be glad to help.
Absolutely, yeah. The VA choice, healthcare choice for veterans, is something that Concerned Veterans for America has fought for years. Ever since the 2014 VA healthcare scandal in Phoenix, we've been fighting for this, and so we certainly don't want to see it rolled back at a time like this. Certainly.
Now, I assure you, we will not let that happen. This is something that's very important to me, and on the Veterans Affairs Committee, we will, and Dr. Rowe, we're all going to fight to make sure this is the future is choice and mission, not backsliding.
I appreciate that, Representative. Thank you very much. And you've been a big champion of it, and it shows. On a related note, you've been a big advocate for increasing flexibility in healthcare options for all Americans. How would legislation like your Personalized Care Act that you introduced give individuals more healthcare freedom by expanding health savings accounts?
Well, I'm glad you asked that question. Just the other day, I had a friend who was asking around trying to figure out what to do to get healthcare because they lost their job and they were stuck because of the current economic situation. This is part of the problem, right? Is that we've allowed our system to be built around this kind of false connection to your job. Not that your employer can't provide you health care. That's all fine and dandy in a free country. But what we don't want to do is have you be reliant upon that. So this friend was then told, we gave her some of the options that, you can go to this direct primary care doctor and you can get care for $59 a month and they'll cover this, and this. And you just go in, you don't have a waiting list. You can sign up for whatever you want. And they said, wait a minute, that exists? Yes, that exists. The problem is we've allowed insurance companies to take charge of and run our healthcare system. And that is just as bad as an overall government-run healthcare system. We don't want that. We want freedom, choice, options. We want you to be able to go to the doctor of your choice. Doesn't mean that there isn't a role, particularly for veterans and for those in our military service, to have hospitals and care that is directly funded and supported by the government. But what it means is we want to provide massive numbers of options for our veterans and for all those in our community to be able to go out and access care. So the Personalized Care Act, the Healthcare Freedom Act, these are two bills that are very similar. I've introduced both in the House. Those bills would increase the amount of money and that you can have in your health savings accounts, and importantly, increase the ways you can use them. Allow you to use that money for direct primary care doctors. Allow that to use that money for example, health sharing ministries where you can share the costs with people. Allow it to use it for catastrophic insurance coverage. Allow it to give you the flexibility to use that money for your health so that you control your health care. Because right now, the problem is an insurance bureaucrat, usually some 25-year-old on the other end of a phone line in Omaha, Nebraska, is picking up the phone and saying, well, this doctor's out of network, or this isn't going to be covered, or this is going to be a deductible of $20,000. You're going, wait, hold on a second. I just want to go get health care. And we've got to return to that, right? And think about the black bag doctor, right? And get to that place. And so personalized care is where we think we ought to go. I think that's going to shine coming out of what we're dealing with coronavirus, where we need more of those options, not fewer. And so I've been happy to promote that. And we're also promoting that within the VA as well, where we've got legislation where we're trying to promote VA DPC, where you've got the ability to get direct primary care services while still under the umbrella of the VA, and make sure that you're covered and you've got the care that you want. Because there's no reason you shouldn't be able to go, especially if you're in a small town and you don't have a VA facility there, go to your local doctor and pay a set fee and be able to get the care you need.
Just a little bit more on this item here. You mentioned the importance of people being able to choose for themselves. At a time like this, where this epidemic is going to hit different communities at different times, it's going to peak at different times. It's going to affect that community in a very unique way, and that's going to happen all across the country.
Yep.
Why is healthcare freedom so important for a country like ours, and certainly in an unprecedented time like this that we're facing?
Well, I think if you want to see what, government-run healthcare would look like, let's go look and see what's happened here with CDC and the FDA getting in the way of the kind of innovation and the kinds of, free thinking that you'd like to see a country like ours engage in. I'm not saying there aren't good people at the CDC and the FDA doing a lot of hard work. There are. Same thing with the VA and everywhere else. And when we put good people to work, they're going to do good things, but there's going to be hangups. There's going to be bureaucracy getting in the way. Healthcare freedom, personalized care. This is about you being able to go get the care of your choice. And in this environment right now, we've seen so much creativity spring up already in the mere 2 or 3 weeks since this has been a hot issue, in the last month or two since it's been on our radar. In the face of the testing snafu with the CDC in January, you had independent folks in states working up and creating tests from the bottom up, as well as in the private sector, figuring out ways to come up with the right tests that would work. In the end, the CDC, working in conjunction with others, they've come up with a good test, and it's now getting out there. And our great free market system is now pumping that out. And we're getting lots of tests and lots of options that are now flooding into the system. But we want to encourage more of that, not less. We want to encourage freedom and options and the ability for you to go get the care you need. Right now, I want every American to walk out and go get a test. I don't want government individuals or insurance companies, frankly, telling you what that needs to look like. We shouldn't have had to run around last week going, oh my God, or 2 weeks ago, we've got to come up with free tests for everybody. Everybody should be able to go get a test. And maybe the government should back up and subsidize something in an emergency pandemic situation. But ultimately, we want it to be low cost, affordable, and easy for you to go get the care of your choice. I don't want you sitting there wondering if you got it. I want you to be able to go check it. But LabCorp and all of these different diagnostics entities, they're cranking up and they're getting ready to be able to produce all that. Our biggest issue now is that we're all sequestering and keeping ourselves sort of separated. And so, we got to figure out how we can get everybody out to be able to get the care they need.
Let's cut the red tape.
Yep. Amen.
So recently, President Trump signed a coronavirus response package that included some emergency funding for many things, including the VA. Can you explain a little bit how this is going to affect veterans in Texas, but also across the country?
Yeah, first of all, let me just take a moment for a non-VA related comment on the packages that have been passed, because it's important to know. We've had 3 phases that went through Congress. The first phase was an $8.3 billion bill that was designed really to sort of help pump up our ability to respond to the pandemic as it was growing in the consciousness a couple of weeks back, probably 3 weeks now. Then there was the second phase. And by the way, I supported that first bill. The second phase, though, I opposed. Now, it had some provisions in it that were good, but it also had some mandates in it to mandate that employers would have to keep people on the payroll if they were off for medical leave for corona-related illness. Well, that's all fine and it's well intended, but the problem is if you're a small business and you don't have funding up front, you can't afford that mandate. And so the federal government didn't provide that initial funding right at first. And even so, you've got the mandate in place that's causing them to lay people off. I knew that would be a problem, and so I opposed the legislation. Of course, the local Austin American Statesman decided they wanted to take some hits. That's all fine. That's what they're going to do. But it's important for people out there to know that for the 40 of us who voted no, it was for good reason. And by the way, I've had dozens of businesses call me and thank me because they knew it was going to be devastating for them. The third phase this last week was around $2 trillion, as you know. It had a lot of provisions in it that I loathed, I hated. it had money in there for the Kennedy Center, for the PBS, for, NPR, I go down a laundry list of pork that was shoved in the bill. But also it had provisions in there for unemployment insurance, which actually has people getting paid more than they were when they were making salary or getting paid by the hour. And so that's a problem. This is what happens when you rush legislation through Congress. But in the end, I sort of reluctantly said I supported it because we need to get capital to businesses so that they can provide jobs for people. And this is what's important. This is not like a normal, or I say normal, this isn't like the stimulus of a decade ago. This is not like a bailout that many of us detest, particularly conservatives. This is a little bit more like a government taking. The government is stepping in and saying, you know what, you can't engage in your livelihood. You can't go make money. You can't open your restaurant. You can't open a Hobby Lobby. You can't open whatever it is because we're concerned about public health. History will judge whether that was the right call or not and how long we do that. But as long as government is prohibiting you, a private citizen, from being able to engage in your livelihood and pay your bills and take care of your family, that's more like a government taking. So I'm a little bit more okay with federal dollars coming in to support and prop people up. The same way as if you take their land for a pipeline or for a road or for a utility, or there's a regulatory taking for some environmental reason, you should get compensated for that. So that's how I approach my thinking on all of this as we go through it. Veterans, I think we'll see significant support coming out of the package from last Friday. As I said, Secretary Wilkie was told fairly emphatically by the president that this was a priority for the president. And so there was $20 billion in there, which is a significant pop, $14 billion for the VA specifically for healthcare. And I believe that we should be in good shape there. There are some questions, of course, about there is a mandate for the VA that they step into the breach in emergency situations, right? And the sort of fourth prong of its 4-point mission. And we've seen that already now get engaged in New York. New York's obviously been taking it on the chin. We don't believe that'll be a huge crisis here because we have significant bed capacity in Texas to deal with what we think is coming, but you don't know. We know that the VA will have to deal with that as it comes. I think the VA has only been asked to prop up 50 beds so far in New York City. So it could come, but it will be put as a part of the balance to deal with the emergency situation, as I'm sure all veterans would want it to.
And that could certainly grow too as the situation develops. No, thank you for that response. And particularly on the spending front, I don't think anybody can argue that our country is a little bit too good at spending money. Military leaders, from an angle of a military veteran, they've called our debt, which is rapidly growing, the biggest national security threat that we face. And in these are unprecedented times, certainly, but how can we change our federal spending habits to better prepare this country for situations like we're facing right now, to be in a better place before we get to them?
Well, I got to tell you, this is a question that actually pushes my anger button a little bit more than just about any other issue. Ever since I've been in Congress and long before it, I've been advocating for some sort of fiscal responsibility and accountability in Washington. This is one of the reasons why I support the Convention of States and other ways to put pressure on Washington to do their job. We haven't been. I've used we loosely. I've been trying, but Congress has not been doing its job. And now we're sitting at pushing now $25 trillion of debt. We're at 24.7. I would have told you before the coronavirus outbreak and our response to it that we were racking up $110 million of debt per hour. That number is now going to go massively up because the $2 trillion we spent last week is more than our entire discretionary budget is in a given year. Now, we'll get some of that back if it's loans and so forth, but we're going to spend a lot of money. And you know what? You have rainy day funds and you live responsibly so that when you get hit, you've got something to deal with. You can borrow to deal with a problem. You have some funds in a rainy day fund. Texas has a rainy day fund, for example. But in the United States, we've been spending money we don't have for as long as I can remember. I believe there are things we can do something about it. I'm hopeful that this crisis will now be a kick in the pants, that we need to actually do our job and do what's necessary to get some fiscal restraint in Washington. But I'll tell you this, as long as people believe that money grows on trees and that at the end of the day, you can just spend and keep spending and it doesn't matter, then we're never going to get the change we need. And too many people in Washington are of that view that there's no consequence to going from 24 trillion to 28 trillion in debt. I disagree. It's undermining our future, our national security. And I do believe, like, as you said, General Mattis said, that it's our biggest national security threat. So we won't be able to fund our national security and defense or take care of our veterans in 5, 10, 20 years because we've been so irresponsible. We need to put restrictions in place and change policies and procedures. For example, I think we ought to go to 2-year budgeting cycles so that we can be a little bit more thoughtful about how we're doing our spending. I think we should put some restrictions in place about when you can, for example, should Congress be immediately raising money in the first 6 months of a Congress rather than actually just doing their job of passing a budget and passing appropriations. In Texas, for example, we meet every other year, and you're not allowed to raise money while you're in the legislative session. I think there are things like that that we need to fundamentally change the game in Washington so that they get slapped upside the head, I'm including myself, but that Congress gets slapped upside the head to do the right thing. It's time. I'm tired of it. We got to do something about it.
Certainly. We'll face it eventually as a nation, and it's on us how we do that. Again, thank you, sir, for your time. Russ, if you're still on the line, I think now would be a good time to transition to some audience questions and give folks an opportunity to ask Representative Roy what they're thinking about.
Absolutely. Representative, I'm going to consolidate a couple of these questions that are similar. One, are veterans allowed to use telemedicine? And if so, how is that working during the COVID-19? Is that being impacted?
Yeah, the answer is that there are expansions in telemedicine, and it is working in ways that are, I think, improving. And I'm hopeful that, like this, like we're doing this on Zoom. There's a lot of folks on this who have never used Zoom before. Now, suddenly, we're going to be pretty expert on how to do this. This is the kind of technology, like we've got right here, that most people haven't been using, that hopefully will transform our system a little bit. I'm a cancer survivor, and I was blessed to be able to go to MD Anderson down in Houston. But to tell you the truth, you should be able to get most of that care if you're in San Angelo, Texas, without having to roll down to Houston, or if you're in Omaha, not have to come down to Houston at MD Anderson, because you can do this. You can get your lab work done, get your test done, and then have some of the best doctors in the world review it, and then tell you what the best care is. And if you have to go someplace special, great. But most care you can do at home or at a local facility. So this kind of telemedicine is actually increasing. As I said, there was more money put into the deal last week, not just for the VA, but specifically for the FCC to be able to expand and do this. And again, I've said before, I don't like spending money we don't have, and we're spending a lot of money last week. $2 trillion is a lot more than I would have chosen to draft. But given the nature of this crisis, and given the fact that government has stepped in and stopped a lot of private sector activity, it's now incumbent upon the government to step in and help deal with some of it. And so I'm glad to see telemedicine as part of that. If you've got any questions about how that should work, I'll reach out directly to the VA, call my office. My staff is pretty expert on how this is all being implemented and put in place.
Candace, thanks for that question. We appreciate it. Nate has a question about what steps are being taken to prevent serious backlogs for veterans, both in the VA and in community care when this crisis is over. Appointments are really going to stack up. Procedures have been canceled or rescheduled. What is the VA even talking about as far as being able to handle that?
Well, that is a good question. It was part of my concern, by the way, about the Mission Act being paused, and my concern right now about the fact that we've got multiple states, most states, that have been issuing these kind of stay-at-home orders, so that now some of our private sector and practitioners, doctors, are not in practice because they've been told they can't do certain things. I think we need to hopefully get those up and running sooner rather than later so that people can get the care they need, because a lot of people depend on their local practitioners, including veterans. I do know that $14 billion, which is a sizable pot of money even in Washington, is dedicated specifically to trying to make sure that healthcare is available for veterans and that they've got procedures in place. And by the way, I think they allocated $2 billion for technology in order to help fix our fairly, still antiquated, needing to be improved technology system. That's one of the things that I've been focusing heavily on in the VA, is looking at our old contracts and how we can make sure that health records and all of the systems that are frankly a hindrance to easily and seamlessly moving through the VA. So they allocated a bunch of money to try to supercharge that as well. But at the end of the day, no promises. I just need you, if you're a constituent or if you're not, call your congressman. Let me know as soon as you see any kind of a backlog so we can immediately get on the VA. If you need care right now while we're in the crisis and you're having trouble getting it, please reach out. if you have a backlog when we get through this and think things are slowing down, let me know, because we want to make sure we're opening up the floodgates of care options for you and not allow that to lag. I do know that Secretary Wilkie is committed personally to making sure they've got the capacity that they need. But this is a little bit of the unknown right now, because we just don't know exactly, depending on where you are geographically, what the overall impact of the virus is or is going to be. But I'm optimistic that we'll be in a position to be able to deal with it.
A couple of constituents, and this kind of goes in line with the question you just answered, mentioned that military bases were closing down their hospitals or clinics to the retirees. They're only treating active duty that are on the base, which contributes to the flow of where they can go right now. Is it kind of along the same lines of what you just said, or is there other options out there that we're not aware of?
Well, similar to what I just said. Now, I will say that is an issue, and I'm glad you mentioned it. And I might know one or two of the people that might be on the call, the constituents that raise this issue, because they've been very helpful in me understanding why this is a problem. We've been raising this issue with the VA directly about our concern about this. And it was one of our priorities about 2 or 3 weeks ago, before we got fairly sidetracked by the dealing with the virus and dealing with the bill last week and so forth. Just today, we were kind of coming back together as a staff to follow back up now with the VA and with DOD about what this now means for veterans and making sure that there isn't a drop off in care, particularly in light of coronavirus. But I'm glad that those constituents raised that concern, because it is a real concern. And we need to make sure that that gap is being filled. I would have said before the pause on the Mission Act that we were gearing towards the Mission Act and creating more flexibility and freedom for people in the VA to be able to, or veterans to be able to go access care. But with the pause in the Mission Act, my antenna is up that we got to make sure that nobody's falling through the cracks. So that's mission one. So please, if you're a veteran and you've got any issue with any of this, please reach out to my office. Data and phone calls is what helps us be able to go and rattle and shake cages over with the VA and or with DOD to make sure we fix the glitch. And or, by the way, with the White House or the governor's office or anybody else. And I should say, Governor Abbott's been doing a great job, in my opinion, in Texas, trying to manage this while trying to keep the economy going, but get us through this safely and securely. It's a tough job. There are always some tough calls. I want doctors to be able to get back to work, and I want people to get back to work. And I'm encouraging that and being a voice for that. But I do think he's doing a good job trying to balance that as best as possible.
Got just 2 more questions for you, but I have a couple of questions on here that look like they're constituent service questions. Do you mind just kind of shouting out your constituent service contact staffers?
Yeah, sure. Well, I mean, first of all, roy.house.gov, just go onto the website and go click, and you can email, you can reach out that way, you can call. Our constituent services team in San Antonio is top notch. They work around the clock. They work their fingers to the bone. And so please reach out to them directly. We've got people in DC that answer policy questions when you have those issues, and they go deal in DC more with the touching VA and so forth. But our constituent services team in San Antonio has been working hard to get, like I said, to get people back from Peru and get people from out of the country in, as well as to deal with some of the issues that have been popping up on the healthcare front. But again, roy.house.gov, that's the best way to do it. Just go there and reach out and give us a call or shoot us an email anytime. We'll respond. Again, we always try to respond within 24 hours if we can.
And then lastly, I've gotten 2 questions on mental health. Obviously there's statistics out there about how many veterans we lose every day to suicide. I do believe some of the mental health questions have gone to telemedicine, but during this pause or during some of the delayed appointments, is there special help for mental health questions that you might be able to offer or be able to point to within the VA, or thoughts that you have about that?
Yeah, well, first of all, this is a critical area that I will say that we've been working on in the Veterans Affairs Committee, both parties. I do think that there's a lot more we still need to do on this front, and I think we've got some more legislation that we've been working on a bipartisan basis to do that. We recently passed some that should make some difference, but I'll note also that as veterans are dealing with a lot of the mental health issues, this is one of the reasons why I believe it's really important that we get our economy back up and running. And I say that as an aside. I'll come back to the direct issue that you're asking about, but this is, you go back and look at the data of what was happening in our country in 2008, 2009. You look at suicide rates, you look at mental illness, depression, you look at opioid addiction rates, you look at what happened to our nation in the, Great Recession, if you will. And you look now at 10 million unemployed in literally 2 weeks, and numbers that we're being told may possibly occur. And I keep trying to remind our leaders, Dr. Fauci and Dr. Birx are focused heavily on the pandemic, and that's their job. And they should have a single-minded focus on trying to kill the pandemic. But we need people with a single-minded focus on making sure our economy is strong and making sure people have jobs, making sure people have livelihoods that they can come back to take care of their families, because your sense of worth and your life existence is being able to take care of your family and take care of yourself, and our prosperity is tied to our jobs. So we need to make sure that we are being mindful of that. And so I've got an op-ed that hopefully will run tomorrow or this weekend or no later than Monday, calling on them, adding people to the task force that the vice president is running, focused heavily on mental health, psychiatry, sociology, and economics, not just defeating the pandemic, because we've got to factor all of this in to a comprehensive approach to make sure our goal is to minimize overall human harm and to count and the lives that are going to be impacted by that, not just the lost life as a result of the pandemic. So it's an important question. Veterans have been dealing with this because of what we've been asking of them. And I could go on a long time talking about, having our young men and women who are now enlisting who weren't alive when we passed the original authorization of force in 2001. I think that's had a long time impact on those brave men and women who have served. And look, they sign up and people go and they serve, and that's great. But when you're asking people to go on their 5th and 6th and 7th and 8th tours of duty, and when they deal with a lot of the things that they deal with, we ought to be there for them by not just fixing mental health, which we need to do, but also not having 20-year lingering authorizations of force, so that we're wondering exactly what and where our men and women in uniform are serving this country. So to mental health, please, again, reach out to my office. We've got a lot of the resources and things we can direct you to or toward, and I'll rattle some of them off, but I don't want to miss them because this is important stuff. I'll also note that I've been happy to talk to my friend Ajit Pai, the FCC commissioner, who I alluded to before about the telemedicine, who's been working to get a national hotline for mental health, kind of like our 911 system.
Okay.
And I think that's a really important thing that we ought to do, so that we get a number, whatever that would be. I don't know what it is, but 711 or something, where you could have a direct hotline that we can all broadcast so everybody knows it, so that nobody is left looking for help, and we all wonder why we didn't reach out to him or her.
That's great. Thank you so much. We're going to end our question and answer time, and I'm going to let you and Nate wrap up. So thank you so much for answering questions tonight, and Nate, hand it back to you.
Thank you, sir. And thank you, everybody, for sharing your questions. Those were great questions, all of them. And Representative Roy, I appreciate your last comment about the U.S. foreign policy. That's also an issue that we care a lot about as veterans. A lot of our staff and our activists have fought the wars of the past 20 years. And so we feel very strongly also about making sure that when we send men and women in harm's way, it's for a good cause. And we appreciate your support on that, certainly. I think that's all the time we have for tonight. So I wanted to give you a chance to offer any closing remarks that you have. What is your message to veterans in your district, the rest of the folks in your district, and really the rest of the audience across the country?
Well, look, first of all, thank you, CVA. Thank you for all that you do. At AFP, everybody that's been part of this, all you veterans, thank you for your service. Thank you for being who you are. I never feel better when I'm going out and meeting with constituents than when I'm with veterans. And I just really appreciate it. And let me say this. This is a moment for all of us to come together. And veterans, you may not see yourself as this, maybe you do, but you're a leader. I mean, people look up to you. My 10-year-old son, my 9-year-old daughter, anybody that is in the district, they look to veterans with pride, whether you're a 95-year-old World War II veteran or whether you're a 28-year-old veteran of Iraq, Afghanistan. Look, we need to come together as a nation. We need leadership right now to remember that getting through fights is not always easy. You got to make tough choices. We're going to get through this. We're going to beat the virus. but we need to do so in a way where we get our economy back and we remind people what we fought for, that you can lose this in a generation. And this is this is one of those moments. And we got to decide what we're going to do and when we're going to do it and how we're going to do it. We're probably doing the right thing, isolating and doing the social distancing here for a bit to make sure we try to drop the spread of the virus. But we've got to get back to being Americans, doing what Americans do best, and getting out and working together and engaging so that we can prosper together. And you can, as veterans, be leaders in that effort and help drive the call for making this a stronger, better country as we come out of this. And know that we're here for you, and know that as you have been here for us, we're here, and my office is here, and we're here to help you in anything that we can. I desperately mean it when I say, please reach out to my office with any issues that you run into. Keep me abreast of it, because I need to know. My chief of staff is a Marine veteran, and he knows some of it firsthand, and we've got some others to do, but your all's reaching out is the way we keep our finger on the pulse of what's happening to make sure you get the care you need, the mental health you need, any issues you're not being addressed, any backlogs that occur. So thank you. God bless you. And thanks for taking the time for joining.
Thank you. Thank you, sir. I love that. Veterans really are leaders. And I think it's a group across America that's well equipped to respond at a tough time like this, and show the rest of America, what we can do as a population, as a people. So, sir, thank you so much for giving us your time tonight. Thank you for the staff for helping us set this up and putting the work that they put into it. I want to thank the Concerned Vets staff that helped us put this on. There's a tremendous amount of work that goes into coordinating and orchestrating, both on the back end and also on the ground in places like Texas. So thank you to everybody who put the time in from CVA to make this happen. You're a great team. I love this team. Lastly, I just want to thank the people who joined us tonight. CVA is an organization of people like you. We care about this country. We care about our veterans, and seeing that freedom and prosperity passed on to our next generation. And so thank you for taking the time to be with us tonight. We encourage you to engage with us online. It's tough to engage in person right now, and that's okay. So we're going to do it online. We're on Twitter at Concerned Vets. You can check us out on Twitter. Facebook, Concerned Veterans for America. Just search for Concerned Vets for America, and we will pop up. And then our website is cv4a.org. CV, the number 4a.org. We've got great resources for folks to draw on, daily newsletters. We have a great blog, and we also have an action center. So you can go onto our website and take action from your phone or your computer right in your own home. It's a great way to get started, and you can find it right on our website. So with that, I just want to thank everybody for taking the time. We've really enjoyed having you on this virtual town hall. Be safe, be well, and have a great evening. Thanks, everyone.
God bless.